Heart attack versus cardiac arrest. When a victim is suffering a heart attack, the heart may be pumping too fast or too slow. The heart may be skipping major beats. This can happen due to a weak heart pump and or blood vessels blocked by a buildup of plaque or blood clots. Signs and symptoms of a heart attack: sweating. The skin may be cold and clammy. It may be blue or grayish purple in darker complected individuals. Breathing difficulty may also occur. The breathing may be very fast to try to get air in quickly, or very slow to try and get as much air as possible. Chest pain may also occur. Crushing, squeezing pain in the center of the chest, behind the breastbone. Numbness, tingling in the jaw, neck, shoulder, and arm can also be a symptom of a heart attack. Dizziness may also occur. The person may have difficulty standing, walking. Nausea and or vomiting because oxygen is not getting to the abdominal area sufficiently. Severe back or stomach pain may also occur. Unconsciousness, unresponsiveness. That's when it's time to call 911, get an AED, be prepared to do CPR. Signs and symptoms of a heart attack continued. Men are more likely to suffer the severe, crushing pressure of the chest pain. Women are more likely to suffer severe back and stomach pain. These differences can lead to the fact that when women have chest pain, it may be much more subtle and mistaken for other illnesses such as the flu. Because women have symptoms different than male victims, sometimes their heart attack symptoms may be harder to recognize, causing a delay in the 911 response. This happens sometimes, and do not take it for granted. If in doubt, treat for shock. Call 911 and monitor closely. Be prepared to perform CPR if unconsciousness occurs. Care for heart attacks. Help the victim rest in a comfortable position, preferably on their back. Call 911, get the AED, assist with any heart medications, monitor closely. If the victim becomes unconscious, perform CPR. Cardiac arrest victims, when the heart is no longer pumping blood, call 911. Perform CPR and use an AED if available. CPR. What is CPR? Cardiopulmonary resuscitation. Cardio is the heart. Pulmonary, the breathing, the oxygen, the lungs. And resuscitation means to live again. The automated external defibrillator. The AED shocks a non-working heart, getting it to circulate blood again, back into the normal rhythm. The AED shocks a non-working heart back into circulation. The world's first AED. It helped save a life. Invented by electricians a long time ago. CPR AED is performed when a victim's heart is in cardiac arrest, no longer pumping blood. CPR keeps the cells in the bloodstream alive, and the AED shocks the heart back into its normal rhythm. The two major components of CPR, the compressions and the rescue breathing. For good chest compressions, place the heel of one hand on the breastbone, the second hand on top of the first hand. Interlace your fingers, pull back so only the heel is in the sternum. Don't compress on the weak point where the ribs meet. The position should be between the nipple line or the base of the underarms. Allow the chest to rise fully after each compression, thus allowing the heart to refill. For good chest compressions, compress 2 to 2 1/2 inches for an adult. For compressions and breathing, traditional standard CPR, 30 compressions and 2 breaths. For compression only, compress continuously to the beat of the Bee Gees, Staying Alive. Rescue breathing with the pocket mask. Place the pointed end on the bridge of the nose. Press on the upper edge with the fingers. Make sure your fingers are on the outer upper edge, not in the center of the mask. You may collapse the mask if you do that, so keep your fingers on the outer edge. Press down for a good seal. Completing the seal, press the mask with your thumb right at the bottom in the middle, 2 fingers on the jaw bone. Avoid pushing in the soft tissue. Get yourself a very good seal. Then head tilt, chin lift. Give 2 separate breaths, 1 second each. Watch for chest rise after each breath. Once again, we place the pointy point on the bridge of the nose. Get a good seal. Tilt the head back. And that's how we ventilate. If at any time while we're doing our CPR, if the person regains responsiveness, we put them on their side to avoid choking up any fluids that they may have in their mouth. AED is on the scene. The first thing you want to do is
This is a training
turn
device
on
only.
the machine.
No shock will be delivered.
And then you obtain the AED electrode pads.
Remove clothing from person's chest.
You remove clothing from the chest, dry the chest off, it may be cold and clammy,
Attach
sweaty.
pads firmly to person's chest, as shown.
You may even have to shave the chest. Of course, first you have your rubber gloves and your scissors to cut off any clothing. Then you dry the chest,
Plug-in connector.
shave the chest if necessary. And the next thing we want
Check
to do,
connector and pads.
we take one of our electrode pads and place it on the upper
Check connector and pads.
right, and the second one on the lower left.
Check connector and pads.
And here's what it would look like. Upper right, lower left.
Check connector and pads.
Next thing you want to do is plug in the electrode cord. Now,
Check connector and
most
pads.
machines don't have plug-in, they're pre-connected, but this one we plug in. We plug it in,
Analyzing rhythm.
it's analyzing.
Everyone stand
Make sure that
clear.
everyone is clear, so it will analyze correctly.
Shock advised.
Shock advised.
Charging.
So it's charging.
Everyone stand
Everyone clear.
clear. Everyone stand clear.
Make sure everyone
Push the
is
shock
clear,
button.
then you push
Shock
the shock
delivered.
button.
Begin 5 cycles of CPR.
If there's no response, then you do CPR. Now with the AED, again, there's a kit, scissors, rubber gloves, a towel to dry the chest off, razor, 27, 28, 29, 30, and a pocket mask that's superior to the flat mask. We place it on, get an excellent seal, tilt the head back. 1 and 2 rescuer CPR. If you find a victim in need of medical care, make sure the scene is safe and then tap the shoulders and shout, "Are you okay?" No response, have someone call 911, get the AED, then check the carotid pulse and for normal breathing, 5 to 10 seconds. If there is no pulse, no breathing, remove restrictive clothing and begin CPR compressions. Pushing on the breastbone, 2 to 2.5 inches, making sure the chest rises between each compression. Once you complete your 30 compressions, you take your pocket mask and place it over the mouth and nose, making sure you get a very good seal. Tilt the head back fully, give 2 rescue breaths, 1 second each, making sure the chest rises each time. Then continue with CPR compressions. When the second rescuer arrives with the AED and other equipment, the first thing they'll do is turn on the AED. Once the AED is activated, the second step will be to remove the electrode pads from the machine, place one high above the right chest muscle, place it on firmly, take your second pad, place it below the left chest muscle. Some machines require a plug-in. Then you clear the patient to analyze and clear the patient if shock is indicated. Once the light begins to blink, clear the patient, push the shock button. If there's no response from the victim, continue with CPR compressions. 30 compressions and 2 breaths. Then the other rescuer will place the bag valve mask on the victim's face, tilt the head back fully, and the compressor will also compress the bag valve mask, and that is 2 rescuer healthcare providers CPR. Child CPR. Check the scene, make sure it's safe. Tap and shout, "Are you okay? Are you okay?" Have someone call 911, get the AED. Then you check the carotid pulse while checking for breathing and normal life functions. No pulse, no breathing, begin compressions. Compress 2 inches for a child continuously. 30 compressions and 2 breaths for the child. Very similar to adult CPR. After 30 compressions, you get your pocket mask, get a good seal, and give 2 breaths. Then continue. Compressions. 30 compressions, 2 breaths. Infant CPR. Check the scene for safety. Tap and shout. Tap the foot. No response? Have someone call 911, get the AED. For an infant, we check the brachial pulse, and for normal breathing, 5 to 10 seconds. No normal breathing? Remove restrictive clothing and begin compressions. 30 compressions and 2 breaths for the infant. 1 rescuer CPR. Make sure your compressions are deep enough. 2 separate breaths, 1 second each, and continue compressions for the second rescuer arrives with appropriate equipment. The first rescuer switches positions, and the second rescuer takes over compressions with the encircling thumb technique. Now the ratio changes. 15 compressions and 2 breaths for 2 rescuer infant CPR, which is the same for child. Pediatric CPR, 2 rescuers, 15 and 2. We find the belly button, place a finger in the belly button, place a fist right above where the finger's at. That places our fist right in the belly, in the soft, right below the diaphragm. In cases of pregnancy, do not do your thrusts in the abdomen. Do your thrusts in the center of the breastbone, in the same position for CPR. You put your fist in the breastbone. This works in cases of obesity as well. Now, if we have an adult, child, or infant that's choking, they may be choking a little or choking quite a bit. If they're choking a little bit, perhaps they'll be able to cough. That is our hope, that they'll be able to cough that object out. So we give them a chance to cough it out. Encourage them, keep coughing, keep coughing. But if the cough gets really rough, because now the airway is starting to close up, that object is getting more and more lodged, and they cannot breathe, barely breathe. That's respiratory distress. So in that particular case, respiratory distress, we want someone to call 911 right away, because it would only get worse. And sometimes they're and then they cannot cough, speak, or breathe. Oftentimes, people assume the universal distress signal for choking. They clutch their throat. If we see this, or perhaps they're just going like that, then we ask them, "Are you choking?" And if they indicate Then we let them know, I can help. And so now we've gotten permission to help. So we go behind them, and if they get nervous because we go behind them and they start getting antsy and change their mind, maybe we may have to explain what we're going to do. But try not to make a long dissertation out of it. I wouldn't say, I'm going to go behind you, do an inward, upward, subdiaphragmatic abdominal thrust, also known as the Heimlich maneuver, which causes a tidal flow of air to dislodge the object from the esophageal region of the thorax. The long-term prognosis and diagnosis of, hey, I'm still talking. Too much information. We want to make it brief. So I'm just going to say, I'm going to squeeze your stomach and get that object out. They're more than happy for you to do so. So we go behind them, we find the belly button, place a fist, thumb side in, grasp the fist, do an inward, upward, subdiaphragmatic abdominal thrust. Each individual thrust might get the job done. We inspect after each thrust. Hopefully, one of these thrusts will cause the object to pop out. Sometimes the object will just land on the floor. Sometimes it will fly across the room with all that force. If the object comes out, then we put them on their side in the recovery position because they may be drooling and crying and, fluid coming out. And we had someone call 911. We always have someone call 911 when we do the Heimlich maneuver. Airway management, always call 911. Some people want to sit down and finish their meal, but that's not advisable. They need to have rapid medical care. There still may be some objects stuck in there. So now, what if the object doesn't come out? It does not come out. After a certain amount of time, they're going to become unconscious. So I'm standing with my feet shoulder width apart, kind of an athletic stance, so I can support them if they do go unconscious. So now this person goes unconscious, unresponsive. I want to help break their fall. I collapse down to the floor with them, protecting their head from hitting the floor is my goal here. Once they're on the ground, I begin CPR compressions to try to pop that object out. Now we're forcing air from diaphragm, is inflating the lungs, and hopefully that object can get popped out. 27, 28, 29, 30. Now it's modified CPR technique for airway management for the unconscious. Modified part is that before we attempt to ventilate, we take a look and see if we see something in the mouth. If we see something in there, we reach in and pull it out. We never put our fingers in the mouth of a conscious person. I look, I see nothing. I see nothing. Well, so I'm going to attempt to ventilate. Even though that object's in there, hopefully I can get air past that object, or the object may shift or dissolve. I attempt, won't go in, reposition the airway, try once again, still won't go in. No, object's in there. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I attempt to ventilate one more time. Before that, though, I take a look. I see something. I reach in, I pull it out. Now I'm going to attempt to ventilate once again. Success! I got the lungs to rise. Now let's take a listen. Maybe they're breathing again. 1,001, 2, 3, 4. They're breathing. Oh, but they're throwing up. So I put them on their side in the recovery position, and they'll have a chance to live again. I monitor them until the 911 response team shows up. That's airway management for the adult, conscious and unconscious victim.
Airway management for the conscious and unconscious child choking victim.
This child is suffering from airway obstruction. She clutches her throat. She cannot breathe. Her mom applies abdominal thrust and the object is expelled from her airway. Right on the shoulder blades. 1, 2, 3, 4, 5. The object didn't come out. Support the head. Come back. And then right in the same position we did CPR compressions. 1, 2, 3, 4, 5. That didn't work. We sandwich them over one more time. Get them in that position. And again, we support there. 1, 2, 3, 4, 5 there across our knee. Forearm and thigh makes a hard, flat surface. It's what we need, that hard, flat surface. 1, 2, 3, 4, 5. Didn't come out yet. 1, 2, 3, 4, 5. Object comes out. Then we keep them in the same supported position. Mouth open, support the head, head lower than the behind. That way objects, fluid and whatnot can come out of it. If the choking infant victim cannot cough, speak, or breathe, support the head by grabbing the cheekbones and do 5 back blows on the shoulder blades, avoiding the spine. Supporting the head once again, turn the infant victim over and do 5 chest thrusts to expel the object from the airway. Repeat these efforts. 5 back blows on the shoulder blades to loosen up the object, and 5 chest thrusts to expel this object from the airway. Whenever you do this procedure, make sure to call 911. The infant victim will need the assistance of the paramedics or EMTs, as well as a rapid ride to the hospital. Repeat these efforts until either the object comes out and the infant's able to breathe, or the infant becomes unconscious, and at that point you would provide airway management for the unconscious infant choking victim. You'll be able to perform this procedure if you need to. You just never know when you may be called on to help save a life.